Hi there, my name is Austin Chow. I am a medical student at the USF Morsani College of Medicine and a research assistant at the Gray Behavior Nutrition Lab. I'm an Asian male wearing black and also have black hair, and I'll be presenting for the AIRP Research Day, our study titled Providers and Parents' Perspectives on Implementing a Nutrition Intervention for Preschoolers with Autism Spectrum Disorder, a qualitative study. So a little bit of background, about 1 in 36 children are diagnosed with autism each year. And these individuals, studies show that they are at an increased risk for health conditions such as obesity and other cardiometabolic diseases like diabetes, high blood pressure, and high cholesterol, just to name a few. There's a lot of causes for this, but I want to focus on the environmental causes, specifically because children with autism oftentimes exhibit adverse mealtime behaviors and restricted food selectivity that definitely plays into developing conditions such as obesity. And to tackle that issue, the Gray Behavior Nutrition Lab created Autism Eats Preschoolers. So this is a nutrition intervention designed to promote healthy eating habits and hopefully reduce rates of obesity in children with autism. I have the logo for Autism Eats Preschoolers here on the left side and the lesson plans laid out here on the right side. So our objective for this part of the study was to take our materials and show it to parent and service providers and get their feedback. And we want to take their feedback and refine our materials to make it better and more inclusive for the communities that we serve. So the service providers and parents they went through a series of focus groups, 3 focus groups, 1 hour each, where we discussed the lessons and they gave us feedback about the content, how the educational materials looked and things like that. We took the focus group audio recordings and transcribed them verbatim. And using the transcripts, we summarized the feedback by lessons, and then we analyzed the content for common themes. Some of these common themes, visually, they thought that there was an appealing use of color and the infographics balanced mix. It had a balanced mix of text and graphics. So, text-heavy pages were balanced well with graphics so that, it was easy to read. Content-wise, they thought the instructions were clear, concise, and age-appropriate, especially related to activities where they could get their kids to participate. And in an opportunity to improve, parents wanted more emphasis language-wise on individualized approaches to lessons, meaning, they wanted us to normalize flexibility when, trying to teach our lessons. And providers wanted more inclusive infographics. That's to say that they wanted more diverse range of foods represented in our pictures that was more relatable for the communities that we serve. So a big takeaway, one size definitely does not fit all, and we want to change our manual to reflect that definitely it is okay to make changes, alter your goals to fit the needs of your household. So, having gotten the feedback, we are wrapping up the inclusion of this community feedback in revising our manual, but down the line, we are going to conduct a study testing how feasible it is to implement these revised materials in the community. And just to wrap it up, how does this affect the community? Well, with Autism Eats, in mind, our goal was to improve community health for children with autism, and in getting community voices, we think that we can make it better, more relatable, and more representative for the communities that we serve. And some successes and challenges. Definitely it's been great that providers are super excited to implement our materials, but, one challenge is that their excitement can definitely outpace, the timeline that it takes to conduct this level of research and to make our materials as good as it can be. And that's it from me. So if you have any questions, feel free to visit our website at thegraynutritionlab.com. That's Gray, Gray. All right, thank you.